Hi, I'm Michelle Malik, and you're watching Indus Special. With e-commerce growing and gaining momentum each year, how has the sudden pandemic impacted online shopping across the world? On today's show, we take a deeper look. Joining us for this discussion is Mr. Paul Weboya, who is the founder of Touchword, a digital marketing agency. He joins us from Kampala in Uganda. Also joining us today is Mr. Ahmed Rauf Issa, who's the founder of Telemart, an e-commerce company within Pakistan. He joins us from Karachi. Thank you both for joining us and welcome to the show. Mr. Paul Weboya, let me begin with you now. As we're seeing, everything around the world is coming either to a sudden halt or is being disrupted completely. With lockdowns, travel bans, businesses are suffering tremendously. But when we look at the e-commerce market, it seems like that's a different scape altogether. Do you agree?
Well, the e-commerce and the online marketing and then business is really being impacted by this coronavirus, but it's not so straightforward as such. It is still a little bit of it continues to evolve as days come by and go. So you find out that each day there is probably an innovation that has come by, and then people are adopting to that. So literally, this is changing the face of online market, online or shopping, in a way that people are coming up with new innovations, new ideas on how to best deliver and do transactions online with the people who are now literally in lockdown and in quarantine. So I think this COVID has opened people's minds, has opened people's eyes in a way of marketing to people or selling products online without actually having contact, because we have an SOP of social distancing. So I think the COVID is opening people's eyes innovatively.
Right. Mr. Weboya, now, of course, a focus specifically on marketing. How do you feel like your marketing strategies have changed for the businesses you cater to, for other platforms that you're also observing, especially when we're talking about online shopping and selling? Is there a greater need to market it in a different way?
Yeah, sure. Apparently, now that we are in lockdown and quarantine, I think the only channels that we have also are still limited to distancing, and that only gives us the opportunity of marketing on that we can actually exploit to see that we move our products from one area to the other. We transact with people who are now in the houses, who are in self quarantine, and then those ones who are actually trying to practice social distancing.
Right.
So I think the only opportunity that we have is online business, to perfect the marketing strategy using the online bit of it. I think the online strategy should be really come out strongly. If there are any marketers out there who really want to make money out of in this pandemic crisis, I think online bit of business is going to be the perfect business, apparently, because we need to practice social distancing. People are not moving to the supermarkets as they used to because we need to the self-quarantine. So it is...
Right. Mr. Weboya, going to now, let's talk to a person who is dealing with this on the ground, in the sense that he does own an online platform that's involved with dealing with customers, selling items. Let's talk to Mr. Issa about how his business has been impacted by what's going on in the world today.
Question talking about e-commerce in a time like this, we always thought that Pakistan would be seeing a good boom in e-commerce in the next 5 years. But unfortunately, the rest of the world is suffering because of the pandemic situation in the world. But the e-commerce industry is at the boom now. We are seeing a spike of 15, 20, 25 times of the revenue of the orders that we are doing on daily basis. And the number is increasing on every day basis. The reason is, at first we were seeing a spike in the health products, the supermarket products, the grocery products only, because people were thinking that the lockdown would survive till 7 days or 10 days. So they were focusing more on the health products, focusing more on the supermarket products. But then, unfortunately, the lockdown is going ahead and ahead and ahead. And recently, only the government announced, Pakistan announced that the lockdown will go down to 30th of April. And for sure, we can understand it will go down a bit more longer as well. So now people are even shopping mobile phones and every single thing. So the customer audience that we normally have is the e-commerce or digital audience. But now shutting down every retail store, every wholesale market, every distribution model, now everybody is the customer of e-commerce. So everybody is shopping online. There is
Right.
no other means to shop. So that is the only reasons our revenue is spiking. We in this scenario, people are downsizing, but in the case of my company, we are even hiring in this case.
Wow.
Because the reason is that we are not able to fulfill the needs of the customer. Plus, the warehousing capacity that we have multiplied the warehousing capacity as well. The reason is we are taking the stock. We are asking every retailer, every wholesaler to just open their outlets or their warehouses for once, take the stock and give it to us so that we can sell it.
Right. Mr. Isana, of course, no one was anticipating this pandemic. And when it hit us, every person with, especially a business owner, had to change their model, had to readjust. Now, you talked to us about how you are trying to maneuver with that, how you're trying to expand your business. What have been some of the major hurdles and hindrances you've had to face, given how supply chains are being disrupted, how it's difficult to even communicate and get businesses to open up and provide the necessary supplies to your platform to sell them onwards?
See, there are many problems that we are facing by now as well. Firstly, the courier partners are not up to the mark these days. The reason is because of the lockdown. There are certain areas, even in Karachi, the place we live, that I live in, even in Karachi, we have 15 different locations, 15 areas that are completely blocked. Even the couriers are not allowed to go there. So that has been a problem as well. Sellers are shut down. They're normally operating from markets, normally operating from different wholesale units in the city, in the commercial market. And every other commercial market is closed down. So we were fortunate enough that we took a good decision before the pandemic situation. We were starting a Pakistan Day sale on 20th of March. So we came up with a new plan to have an express delivery portal where we would be providing customers with instant deliveries across Pakistan. And even in Karachi, we were delivering within 3 hours in Karachi. So for that reason only, we had a lot of stock in our warehouses. And that was a plus point for us. Nearly every e-commerce company in Pakistan is not operational. And in this scenario, Telemart is being one of the most aggressive players in the industry. The reason is that we are keeping stock in-house. Even yesterday only, we are trying to push every seller that please just open it for once, or there are sellers as well who have an idea about the situation, who took everything that they had to their homes, to some safe locations where they can deliver us to. And now we are taking products in bulk from we always had a model of drop shipping, or we had a model of order-to-order basis inventory. Now we have moved to a very different model, which is keeping inventory in our warehouses and then delivering it to the customer.
Right. Stay with me on that point, Mr. Isa. I want to talk more about the SOPs you have in place, especially when we're talking about how to make sure deliveries are safe, how they reach the customer safe with minimum risk of transmission of the virus, all those practices that you have in place. But before that, I want to jump to Mr. Waboya and talk to him about something that Mr. Isa mentioned, was that, of course, people are realizing that this lockdown might be in place for much longer than they had hoped or anticipated. And now they're changing their ways. One of that obviously leads to how consumer behavior is changing. Are you noticing shifts? We've been seeing panic buying. We've been seeing many other things happening. What are some of the trends you've been witnessing?
The consumer behavior, when you look at the previous trends of online or online shopping compared to the current trends, there's a very big margin, and there's a very big difference between the two concepts. Previously, online marketing was online shopping was mild. Apparently, online shopping has multiplied up to 78% of the people. Apparently, in Uganda, people are using social media to access CTAs, to know about products, to get knowledge about a couple of products around. So social media has multiplied by 200% in Uganda right now, in that everyone who wants to buy something probably goes to a social media platform of a particular company that offers that service or product, and then they click, and then they find out the pricing and they buy. So apparently, the consumer behavior is in a way that people are buying essentials, products that are gonna last a little while. Things that are, let's talk about cereals, let's talk about preservatives. So people are buying particular products that are going to stay for a longer period, because each day we get extensions of the lockdown. The president yesterday just added more 21 days of self-quarantine. So apparently people have no hope of actually, having an immediate, opening of markets and transportation. So people are buying things that are going to last a little bit more longer without expiring, and then they're buying essentials that are really important in this kind of a crisis, so that they do not just waste money on a product. They buy something that will last, and then they'll be helped for a longer period.
Right.
That is the kind of consumer behavior that we've realized apparently, and then the online bit of it has really increased. We realized that there is a whole 68% of people that have now started embracing online shopping apparently in Uganda, as vis-a-vis the usual shopping of going to the supermarket physically, maybe driving somewhere to the company premises.
Mr. Webwe, those are a bunch of points that you've listed out here, points that are very interesting to note how consumer patterns are changing. And thank you so much for your insight and joining us on the show today. Mr. Issa, talking more about some of the consumer behaviors. Now, we heard how there is a shift in the type of items people are seeking out, the type that they're buying more of. Now, one of the main things we've heard, and we've also heard our Prime Minister urge people not to indulge in, is panic buying, bulk buying. Now, businesses do during this time have to act more socially responsible than relative to other times, especially given how this is an emergency situation. How's your business coping with that issue of bulk buying, panic buying?
See, you cannot stop someone from buying if they want to buy in bulk. But for a reason that we don't want people to panic buying. Fortunate enough, Pakistan is fortunate enough that we are not seeing panic buying so much as we are seeing in the West or in China for the reason, or in Italy for the case. In Pakistan, we have been seeing one thing, that we have limited our website that every product, you can only buy 5 in quantity. Every product that can be bought would be in 5 quantity. That is the maximum of all. So we are not allowing customers to buy more than 5 products in a cart. And we are not even allowing them to or place order on regular basis. And these are for the products that are not available very widely. The products that are available widely, and we think, yes, we have ample quantity, ample stock to cater to customer for the next 2 or 3 months. Then we have open end for those products as well.
Right. Now, talking more about the maintaining social distancing for the workers, and also for making sure that the products themselves are hygienic, they are not contaminated in any manner. What are some of the SOPs that you and many other businesses that are operating online are adopting? What are some of the guidelines?
First thing that we are not fully operational. I guess 60% of my team is now sitting at home and they're working from home. The first thing is that for social distancing, you need few people in the office so that they're not very close to each other. Secondly, we are not allowing our individuals to come without disinfectant sprays, without sanitizers, without masks. And that is, everything is provided by the company. Thirdly, for the warehouse and for the products that we have in warehouse, we are using disinfectant sprays so that every product that enters our warehouse is very clean. We are not allowing couriers to enter our warehouses. We are only allowing authorized individuals from my company only to enter the warehouses. And we also have we always have been pushing the courier for this as well. And the courier as well is acting very smartly and in the right manner. They are also using sprays on their vehicles, and they are also providing sanitizers to their staff as well. So that we are trying every single thing so that when the product reaches the customer, it's pretty clean and it's not the one that is creating more and more panic in the country.
Right. That, of course, are guidelines that should be followed throughout for all businesses that are dealing directly with customers and for their own staff as well, that they should have hygienic practices all across. I want to introduce on that point Mr. Gilbert Van Kerkhove, who's an economist and president of Beijing Global Strategy. He joins us from Beijing. Thank you so much, Mr. Gilbert, for joining us, and welcome to the show. Now, as we've been talking about the e-commerce landscape, how that has been impacted, we heard our guest here, Mr. Issa, talk about how his company is expanding, and that seems to be a trend all across the world. Amazon has just declared that they're going to be hiring an additional 75,000 people. What has the situation been like in China, which has one of the largest e-commerce markets in the world?
In China, I think we have now quite a lot of experience in dealing with house delivery. We have quite a sophisticated system. As the other gentleman already mentioned, it has to start with the delivery company that has to maintain very high hygiene standards. I was just watching the movie on your screen, and I see people within the company without masks. In China, it's mandatory that all the staff has masks. Also, if it is food delivery, for example, the food delivery must have a small piece of paper giving the temperature of all the people involved in the delivery. For example, the cook, what's his temperature? The server, what is his temperature? And then the packing. This, of course, needs a lot of logistics. Packing in Beijing for the moment. People cannot deliver straight at the residence. They have to deliver at the door of the compound. They call you, and then you can go and pick up the food. Many other issues to look at. As you mentioned, Amazon, the big issue is those companies that provide goods, be it consumer goods, be it food, they need to have their deliveries coming in, so they have the raw materials. So the government must make sure that if there are restrictions on traffic, that those trucks that must deliver the goods to those companies, be it a kind of an Amazon or the restaurant, that they can deliver in time. This might become a problem, for example, in the USA, where meat companies today are closing down because some of their staff has got the virus. So maintaining hygiene, inspecting the status of the workers in the company is very important. As was mentioned earlier also, obviously people can work from home. That is okay. But at the end of the day, you still need people to do the packing and the delivery. Delivery is another issue in China, I must say, very well done by the delivery boys.
Right. Mr. Gilbert, now talking about China specifically and how the situation seems to be defrosting, slowly opening up marketplaces, slowly trying to open up the economy. How is testing playing a role in trying to make sure that the virus, that there isn't a second outbreak, especially when we're talking about workplaces and businesses?
Well, just today, somebody sent me a message from Australia. They read that all things are back to normal in China. My reply was, no, they aren't. Especially in a city like Beijing, restrictions are still severe. 80% of the restaurants are still closed. Also, meeting people still is difficult. The compounds are closed to visitors. And deliveries, for example, still have to be delivered at the door of the compound, at the gate, cannot go in. So do not think that everything is back to normal. Many of the employees, the workers in the factories, still cannot go to work, especially in a city like Beijing. They have to go to quarantine that can take minimum of 2 weeks, in some locations even 28 days. So there is still a lot of obstacle to resume normal operations. If you look at restaurants, is one thing. But factories, that's another issue. And do not forget that there is a bottleneck in the harbors for things going in and out, import, export. Some of the harbors are having difficulty. There is a shortage of container ships and container shipping.
Right. That is one of the last that I want to pick up on and talk to you about. This global supply chain that we've had, this globalized supply chain, that has been one of the root problems as to why we're seeing such huge economic disruption. Now, when we're talking about online markets and them stocking up on things, how is this happening on an international, global level? Is there enough supply chains operational at this point? What more do we know about it?
Exactly. That's the point I was just making. We have a big problem in international shipments. For example, if you look at China, many of the airlines, they can only come once a week from a certain country. People are trying to get more cargo planes, not just passenger planes, but obviously deliveries are being hampered by a lot of restrictions. Also, like I mentioned, container ships is a big issue. As for now, here in China, we haven't felt any real shortage of deliveries, be it coming from the USA, from Australia, New Zealand, and things like that, because we import a lot of meat, we import a lot of commodities from the USA. For them, it's still okay. But when you look at the difficulties that are coming up in the USA, that's really a big risk we are facing today, that the supply chain is going to suffer. Right. And as you see, this is also the other way around from China. There was just an article recently. We have in Yiwu is the big market for export in China, right, where everybody around the world comes to buy. It's deserted. The business people cannot come to make orders.
Right. Mr. Van Kortkov, we're going to have to end it at that point. Thank you so much for joining us. Thank you, Mr. Ahmed Rauf Issa, for joining us. We're going to go for a short break, but when we return, we talk about how artificial intelligence is playing its role in trying to fight the coronavirus all across the world. Stay with us. Welcome back to the show. Now, technology has become an indispensable tool in the fight against coronavirus. On today's show, we talk about how artificial intelligence and data collection is being gathered and used, and what are some of the concerns that are being voiced with surveillance systems becoming more extensive around the world. Joining us for this discussion is Mr. Ali Brilan, who's a journalist focusing on technology and disinformation and politics. He joins us from Washington, D.C. Also joining us today is Mr. Kan Deng, who is an expert on medical AI and the founder of startup RX Thinking. He joins us from Beijing. Thank you both for joining us and welcome to the show. Mr. Ali Brilan, I'd like to begin with you. Now, when we talk about the fact that technology might aid in the fight against coronavirus, how and to what extent can it truly do that? And are we actually more reliant on it than just using it as a mere tool aiding us in the fight?
Yeah, technology is very important. There's a couple different ways to do it. They're more traditional, like still technological, but quote unquote lower tech responses that we can use that would help us. Things that are already being used like drones and thermal scans. We can kind of go to the next level and use AI. And a lot of countries and companies within different countries are starting to use that to try to implement different algorithmic solutions. But it's important to note, though, that a lot of AI technology, even prior to this, was still early and nascent, and we didn't have a firm understanding of how it was working, and there were still problems with bias and all of these other different things. And so even as people are starting to use AI, there are limitations to that. We will be reliant on technology, but it's still very early, and we're trying to figure it out.
Right. I want more into that, the problems with using AI, the ones that we already knew existed in terms of biases and profiling of people in a certain manner, but talking more about how countries are now experimenting with using AI. What are some of the ways that we're seeing this being done, especially by big tech firms?
It's really early, and companies are still talking about this. Like, there's not exactly a lot reported on how it will be implemented per se. But one of the earliest examples that we do know is that they are using AI to augment fever detection technology. So instead of having people manually kind of look at different fever scanners that are seeing people in public places, AI is trying to scan and say, oh, this person might have a fever based off of what it reads from the scanning, as opposed to individual people doing it. Other potential use cases include like taking in large data sets and then using AI to parse those data sets to try to figure out what's happening based off of people's movements. If that data set is for like cell phone location data or things like that. But there still hasn't been a lot of firm uses, and they're trying to figure out how they can and can't use the technology yet.
Right. Mr. Kanding, China, of course, is being applauded all across the world for how it dealt with the coronavirus. But of course, we also know that China has the most sophisticated forms of AI and data collection in any part of the world, which made it possible for this to happen. Now, when we talk about the World Health Organization saying that test, treat, and trace are the three main components of trying to fight this disease, how do you think AI and technology in general aided China's fight?
Well, AI doctor has played a very important role when we are fighting against the coronavirus, especially because the pandemic is very severe in China, and we are short of all these doctors and the nurses. Especially we have a lot of remote rural area. This problem is become even bigger. So with AI, somehow we can train this AI model based on something we call the electronic healthcare record. We learn all this clinical skill set from all this EHR, electronic health records, to learn the skill set and enlarge the productivity, efficiency to applying this technology to those remote area. So that's very important in China.
Right. So you're talking about how the different ways in which it's being used. Now, earlier, Mr. Ali Burlan pointed out how AI has, and many other things that come with AI, have been seen with great skepticism because of the dangers and concerns they pose to society at large. Are these some of the conversations that are going on in China about the dangers and drawbacks of using these types of technologies?
Everything has its advantage, also has some concerns. One of the biggest concern is about the privacies. Since that we have a lot of cameras on street, also we have a lot of equipments measuring the temperature of every people in the subway station. So somehow this is good because that's for the health, for the public. But on the other side, you can see this is a little bit, concern on the privacy, right? So, it really depends, very controversial.
Right. Mr. Burlan, let's back to that point about how controversial it is, and let's talk a little about facial recognition and these sort of technologies which create a more extensive database for the government, for other companies to use later on for other purposes. What are some of the dangers we've already seen being attached to these technologies?
So it's important to say that, like, in certain basic cases, using AI on things like fever detection technology, there's not a lot of ways potentially for that to be abused. Those kinds of things can be good, but in other cases, like you're saying, bias can come into play. For example, United Healthcare tried to implement AI augmentation and care that it recommended to different members that it had. It had this program called Optum. And what it found, though, was that Optum was very biased against African Americans. It was recommending less treatment. It was recommending less useful treatment. It was just like not as good of a system. And what happens recurringly in the United States, not just in healthcare, but sort of any field that there is AI that is comprehensive, that's making recommendations or trying to track things, is often biased against already marginalized groups in the U.S. So people who have less money, people who are of different minority groups who are not treated as well as white people are in the United States, those kinds of groups often have a harder time because the data sets in the United States are often biased against them. So, in the U.S., if you do believe that police are biased, the arrest data sets that AI will be used, police AI will be built on top of, are already going to be biased. And even though people are aware that this is the case, we don't have a way to correct that yet. And so the way is to be very hesitant on AI, to be very careful and not implement it until you're absolutely sure that it's not biased and it doesn't make sense, because especially in healthcare, people's lives are on the line. So not giving the correct healthcare to minority groups is very dangerous.
Right. Mr. Kandeng, on that, I would like your take and insight on this as well. When biases can transfer from, data sets into how healthcare policies are implemented, who is diagnosed, in what way, what type of healthcare is provided, what are some of the ways, if any, that the government can at least try to regulate this? Because in a pandemic like the one we're seeing, one person being adversely impacted means an entire community.
Yes, that's true. So during this hard time, most of the people in China recognize this is a benefit to use all this camera, all these temperatures to measure the danger for the public. That is a good thing for this special time. The controversial topic or the concern is that after several months, when the pandemic is gone, whether or not this system is still useful and no harm to the public. That is the controversial topic.
Right. Now, talking a little more about those biases that are going to be overcome, what are some of the things that you feel like other countries can learn from China's example of the use of this technology when they're especially trying to provide and use this technology for healthcare provision? What are some of the lessons that can be learned from China's case?
So one thing very interesting is that the tracking of the people's, his travel things. For example, if somebody is traveling from Wuhan, which is the center of the pandemic, so far we have the camera. Also, we can track the mobile phone to see which restaurant he visited, which community he is visiting, or maybe some people he is in contact. That is very useful for this specific time. But after several months, whether or not it's good, is that a bias or some for the privacies? That will be a big danger.
Right. Mr. Ali Burlan, now the United has unfortunately become the epicenter of this outbreak. And with that, more and more policies are being devised each and every day on how to go about this, how to tackle the issue. What are some of the ways you feel like technology is being talked about, not just AI, but other forms of technology, and are being rapidly adjusted for the situation?
Yeah, so one technology that's being talked about implemented is drone technology, basically to do some police work. So instead of police going around patrolling areas and saying, hey, this gathering is too large, there's talk of, and some police forces in the U.S. have already started to try to use drones to spread audio messages and see if there are groups that are too large. There's the thermal scanning that I talked about that's a different issue. And then people are starting to sit down with different AI data sets and try to brainstorm how they can be used. Another big limitation that they're running into is that the data sets on coronavirus are extremely limited. So scientists are figuring out, and epidemiologists and doctors are figuring out in real time, like what the best way to use these tools for different AI tools would be, and they're not sure yet. But yeah, it's early. People are still trying to figure it out. The government and Google and Apple and companies like that aren't sure yet.
Right. Thank you so much, Mr. Ali Burlan, for joining us and taking out the time to talk to us. Mr. Kandeng, now there's a lot of talk and speculation about AI being used also not just to fight the coronavirus, but to find cures. Is there a truth to that? And if there is, how is that being done?
Oh, this is a very interesting and very inspiring topic. So far, we have, for our company, we have more than 800 million health records. Each record is actually a clinical route, step by step. Okay, so far we have more than 800 million such kind of EHR, the health care record. So we transform each one of them into a clinical route, step by step. So sometimes some cases are noisy, meaning we have mistakes over there. But compress all these 800 million records together, you will get a map. This is called a medical map, okay? Or we call it a medical knowledge graph. So based on this map, we can do the navigation, which means a step-by-step guidance for the doctor to be the assistant. So during this pandemic time, it is proven to be very useful because we are facing a very severe shortage of all those doctors. We are applying this AI model to Wuhan. We have something called a cabin hospital. A lot of patients over there, but only a few doctors. We are applying this AI doctor models to monitoring all those patients. So something like a screening to save the labor of all those doctors, which is very useful. Even after this time, we still have a lot of remote rural country in China, which are poor, which don't have sufficient, healthcare power over there. Then we can apply all those things to deliver the healthcare service to those areas.
Right. Mr. Kandeng, now curious to know that China, of course, has offered its expertise to many other parts of the world. But when we're talking about technology in this manner, which is very integral to state infrastructure, is there talk, is there discussion of helping countries which are not as technologically advanced, aiding them, helping them, and even perhaps helping rivals like the United States?
Oh, yeah, that's a very, very good topic. So basically, we are cooperating with a lot of different countries. Advanced countries like Japan and America, they have very advanced healthcare power, technique, and people. We try to clone their data set, their mindset, the skill set, and deliver all those services to those remote area like some countryside in China or other rural side. So even we don't have a very good infrastructure in all this remote countryside, we still have a lot of ways. For example, we have the equipments, we have all those remote phones, mobile phones, something like that, so that we can deliver all those healthcare services to this remote area.
Right. On that point, I had also introduced Mr. Pierluigi Pagnini, who's a Chief Technology Officer at Sybase, an IT security company. He joins us from Rome. Thank you so much, Mr. Pagnini, for joining us, and welcome to this show. Now, as I was talking about the fact that this technology is being used and is being rapidly evolving according to the situation in many parts of the world, many other parts of the world don't have that sort of infrastructure, don't have that sort of technology. Is this an opportunity for greater internationalism, seeing countries come together and the transfer of technology, when just previously before this pandemic, we saw technology being the root of many Cold Wars between countries?
Well, I can tell you that the risk is concrete. The main change that we are assisting is related to the so-called medical surveillance that aims at containing coronavirus outbreak. Almost any government is evaluating the possibility to adopt any technology to track the spread of the virus among the population. It's clear that some governments could propose their solution to other countries. For example, let's speak about contact tracing application that could represent an immense source of data depending on their implementation. Some contact tracing, for example, use GPS location data that could be abused to perform dragnet surveillance. It's clear that foreign governments could use this data to conduct, for example, cyber espionage, to conduct sabotage. Another important source of information is represented by social networks application and instant messaging solution that are getting an enormous amount of data. So basically, to respond to your question, I believe that there is a concrete risk, and for this reason, the government must carefully monitor any kind of support and any kind of technology that we use.
Are we seeing this abusive technology already unfold?
We cannot say that we are seeing an abuse of technology in this phase. I'm more concerned about what could happen when the pandemic will be concluded. I believe that there is a concrete risk that the technologies that has been used in this period to support the medical surveillance could be abused to perform many other kind of malicious activities. Let's consider also that another aspect that will be very important is the information sharing between governments. And what I can tell you that we assist at different information sharing between different actors.
Right. Talking about that data sharing, that information sharing, how crucial is that in this time? And especially exchanging of data that, of course, many countries hold close to their own chests. But in this situation, how important is that data sharing?
I can tell you that in this situation is essential, the sharing of the information. But if you ask me what will happen between states, I can tell you that it depends on which states are involved in the process of information sharing. In some cases, I believe that we will be assisted to a major circulation of information. Let's think, for example, to 5 countries, US, United States, Canada, Australia, and New Zealand. In other cases, I believe that the circulation will be only partial. Who control the data will control the world. And I believe that we will assist a sort of mutual exchange of information only if there will be a real interest between states and organizations. Every country will continue to persecute individual interest, and data is a new power. So I believe that we will assist, it's difficult, we will assist to a disinterested information sharing.
Right. Now, talking about the policies that can be implemented right now, and how essential is that to happen in terms of how this infrastructure, how these technologies will be used in the future? Is there a way to come up with policies right now that could also protect the future use of these technologies?
I can tell you that is crucial. Privacy watchdogs must control the data collection, data sharing, and data redaction, and must control that they are compliant with the existing privacy regulation. In Europe, for example, we have the GDPR privacy regulation that establishes specific rules for data management. It is based on transparency and explicit consent of the individuals for data management. A good thing could be the adoption of a similar regulation, but on a global scale. I can tell you that is an hard job, in my opinion. Consider that our data circulate in cyberspace that is, for definition, a place without boundaries. A global accepted privacy regulation could be the primary subject to discuss between the government worldwide.
Right. On that point, thank you so much, Mr. Pierluigi Pagnini, for joining us, Mr. Kandeng for joining us. Thank you for watching Indus Special. We will see you again next week with more stories. Till then, please stay safe and stay at home. Goodbye.